Welcome to this training video on how to use Parafricta Bootees. All these products are intended to aid in the prevention and healing of pressure ulcers, either alone or in combination with pressure relieving products. They can also be worn over wound dressings. There are 3 different models of Bootee. There are 2 reusable and 1 single patient use version. My colleague will describe whilst I demonstrate.
This is the reusable slip-on version, which is the most widely used. There is also the Velcro closure Bootee like this. The Velcro closure Bootee is best used on patients with swollen ankles or requiring protection higher up the leg, over the ankle bone. The third type is for single patient use, which is in the Easy On style.
It's important to remember that pressure ulcers, sometimes called pressure injuries, more commonly called bed sores, can lead to very serious, even life-threatening health consequences if left untreated. If you or anybody in your care has a pressure ulcer, we strongly advise that you speak to a qualified healthcare professional.
The Bootees of all styles are designed for wear in bed and may also be used whilst the patient is seated in the chair. The non-slip sole will assist in safe transfer from bed to chair. Their aim is primarily to protect the heels, but will protect other parts of the foot which are at risk of pressure ulcers, such as the side of the foot or the ankle bone. Having chosen which style of Bootee to use, the next step is to choose the correct size for your patient. You can do that by measuring the length of the foot from the heel to the toe, and then consulting the size selection tables, which you will find in our user guides and online. If in any doubt about which of the 2 sizes to use, always select the larger option. In the case of the Easy On single patient use Bootee, there's an extra measurement you need to take. So as well as taking the length from heel to toe, it's important to measure the patient's ankle circumference. If the ankle dimension exceeds that recommended for the length of the Bootee, then you should either use the next size up or switch to the looser fitting Velcro closure Bootee. When using the Velcro closure style Bootee, firstly release all the straps. That will make it very easy to slip the patient's foot into the Bootee. You can then secure the Bootee with the Velcro straps. The Velcro Bootee should be used rather than the slip-on Bootee if the patient's ankle bone is affected, as the protective fabric extends further up the leg. In all cases, it's important that the skin of the foot is in contact with the low-friction lining of the Bootee. Patients should not be wearing their socks underneath these or anything that comes between the skin and the low-friction fabric. Except, of course, if either anti-embolic or compression hosiery is prescribed by a medical professional to be worn inside the Bootees. In all cases, as well as preventing and being used to treat pressure ulcers, the Bootees may simply be used to help retain wound dressings which tend to get rucked up and displaced by the action of friction and shear. If a Bootee becomes soiled or clinical judgment is that they are no longer clean enough to wear, the reusable Bootee should be washed and replaced, and the single patient use Bootees should be discarded and replaced.
There are 2 important precautions to highlight. One is that Parafricta Bootee should never be worn directly over an undressed open wound or open pressure ulcer. They are suitable for wearing over a dressed wound. A further precaution is that whilst Bootees are ideal for Category 1 pressure ulcers, which are characterised by non-blanching erythema and other changes in skin condition, they should never be worn alone when there is a suspected deep tissue injury. Most healthcare professionals will recall that a deep tissue injury will present with a deep purple colour and other changes to the appearance of the skin on the heel. It's a condition which should only be treated by offloading the pressure from the heel according to the guidelines.
The way that Parafricta works is by providing relief from friction and the shear associated with it. If you'd like to understand more about how the Bootees work, please look at the video on our website. An ideal time to use the booties is preventatively, in situations where the heel and foot are exposed to high levels of friction and associated shear, and before the skin begins to break down completely. For example, any patients who frequently use their heels to push themselves up the bed, or any condition where a patient will be restless or will exhibit any form of chronic repetitive movements. There are other conditions where the skin is likely to be very vulnerable, for example in diabetics or people with very fragile skin or at the end of life. Whilst prevention is ideal, the booties can be used on Category 1 pressure ulcers, and they can be used, when advised by a healthcare professional, on Category 2 pressure ulcers which have been dressed. We advise elevation or offloading, if possible, for any Category 3 or Category 4 pressure ulcer or suspected deep tissue injury. But it may well be that in some cases that it is very difficult to manage the patient using mobilization, elevation and offloading. Healthcare professionals may judge that it is necessary to use a combination, for example, of a pillow and wedge with a Parafricta Bootee, to provide the maximum possible level of relief to the affected area. The slip-on and Velcro booties can be washed, ideally in a light load at 60 degrees on a synthetic setting in a domestic washing machine. Hospital laundries and commercial laundries often have a special setting called a sanitizing cycle, which will go up to 70 degrees for up to 10 minutes. They're fine with that, and they can be tumble dried on a low temperature synthetic cycle, or at home patients will very often air dry the booties. Sometimes the booties may become heavily soiled, which is just not removed by normal detergent. Then a proprietary oxidizing stain remover will help to remove those stains. You can even pre-soak them in those, but never use domestic or chloride-based bleaching agents. The booties should not be ironed or dry cleaned. The easy-on single patient use booties cannot be washed and reused, but light soiling can be removed with a moist sanitizing wipe.
In summary, 1. Remember that pressure ulcers are a serious condition and should always be addressed by a healthcare professional. 2. Consider the most suitable style of bootee for your patient. 3. Measure the length of the patient's foot from heel to toe. With the easy-on bootee, also measure ankle circumference. Choose the most suitable size of bootee. 4. Never place the booties directly over an open ulcer or wound. 5. Change or replace the booties when they become soiled. 6. For reusable booties, follow the washing instructions on the care label and IFU.
For more information, please check out our website, parafricta.com. You can email us at info@parafricta.com or call 01869 226 566. Other information on how to use the booties is in our user guides, which are available online.